Welcome everyone to this webinar on back to school during COVID-19 for kids with type 1 diabetes. My name is Kim Hanson and I'm an executive director with Diabetes Canada, and I'm really pleased to be with you all today to have this timely and interesting discussion. I am someone who lives with type 1 diabetes. I have done for about 25 years now, and I am also a mom, although I admit that as of yet my children don't live with diabetes. I'm really pleased today to be able to, in collaboration with some of our experts, share with you some information on what the risk of COVID-19 is to kids with type 1 diabetes, and then to help offer some tips that can support you as parents in planning September and beyond, whether you're choosing to send your children back to school, homeschooling, or whether you're maybe still undecided. Please note that we will not be commenting on the specific back to school safety protocols of any individual provinces or school boards across the country. We're pleased that we've got folks joining us from across Canada today. So this is going to be a little bit more general than that. And it'll just give us some general considerations in terms of best practices for a family with a child with type 1 diabetes. Before we get started, it's really important that we stress that there is no one right answer to this. Each family has to judge what the best decision is for them based on their individual circumstances. And so our purpose today is really to offer you information and to hopefully answer some of your questions to help support you in making the best decision that you can for your family. I'm really pleased today to be joined by our experts. Dr. Constantine Samaan is a pediatric endocrinologist at McMaster Children's Hospital. Dr. Samaan, thank you so much for being with us today.
It is my pleasure, Kim. Thank you for the invite.
I'd also like to welcome Elizabeth Moreau, who is the Director of Communications and Knowledge Translation at the Canadian Pediatric Society and a founding partner of Diabetes at School, and also a mother of an 11-year-old living with type 1. Elizabeth, thank you so much for being with us today.
Thanks for having me.
And last but by no means least, thanks so much, Conrad Powell, for joining us. Conrad is a senior program manager at Diabetes Action Canada, doing some really cool work for those of us with type 1 as his day job. And he's also the father of an adorable 6-year-old with type 1. Thanks for being with us, Conrad.
It's a pleasure to be here. Thank you.
Just some housekeeping before we dive into our session today. We will be recording this session and making the recording available on Diabetes Canada's YouTube channel within the next couple of days. So you will be able to go back and review any of the comments if you want to sort of check on anything that we said. Certainly you'll be able to share that with your community if you'd like to. And we're also going to be welcoming questions from our viewers during this session. So if you're joining us on Facebook, please feel free to send your question in the comments function. If you're joining us on Zoom, please use the Q&A function, and we'll do our best to get to as many of the questions as we can in the next hour. If we can't get to your question during the next hour, my colleagues and I will get back to you by email as quickly as we can with an individualized answer. I also want to make a quick note before we get started that to say that while we're going to be talking a lot in terms of type 1 diabetes, we really do acknowledge that there are some kids with diabetes in Canada that have type 2. And the tips and advice that we're offering today should generally apply to kids with any type of diabetes. So please understand that we mean this relatively broadly. So Dr. Samaan, let's start by addressing what is the relationship between COVID-19 and type 1 diabetes. Are people with type 1 at greater risk?
Well, Kim, there is at this point no evidence that kids with type 1 diabetes are at higher risk of getting COVID-19 or of having a more severe infection if they do get the virus. This research is still emerging, and a lot of the information that we've seen in the media are really related to adults, and the type of diabetes is not necessarily always reported. But what has been reported in the adults, there are at sometimes when they have diabetes, they're at more risk of developing more severe infection. And some reports have also reported a higher mortality. There's no evidence that this is in fact the case in children with diabetes. And in general, children seem to do better than adults. And if I may frame this conversation just by numbers, out of the almost 123,000 Canadians who got COVID-19, less than 10,000 of those are actually children. And of those, close to 10,000 kids, about only 138 kids actually ended up being hospitalized for COVID-19. And of those, then only 27 children ended up in an intensive care unit for a variety of reasons. We don't have more data to kind of give us more grainy detail, but these numbers remain relatively small. And for children with well-managed diabetes, the prediction is that they will have similar symptoms to other children with no diabetes, and the sick day management guidelines will apply should they get this infection. But of course, when an infection happens, this may lead to challenges with controlling the blood sugars, and that will then result perhaps in an increased risk of ketones and of DKA. So this is kind of the framework from which we're approaching type 1 diabetes in kids and the risk of COVID.
Okay, so really still lots of research to be done, lots more data to be gathered, but thanks for that context, Dr. Samaan. And so just to dig into that a little bit further, one of our viewers today asked a question before this session, which was, does the risk to COVID increase with someone's A1C? So if an individual has a higher A1C, are they at greater risk?
So that's a great question. With the limited evidence that we have so far about the effect of COVID-19 on children with diabetes, there is currently no cutoff available for the A1C. From the adult literature, the cutoff of 10% has been proposed as a number that patients should take extra precautions with diabetes. But on its own, 10% is not a good reason, for example, not to return to school. And we certainly suggest that there is a need for a lot more research before we can figure out even if there is an actual cutoff to ensure the safety of kids.
Fair enough. Now, just quickly, in reference to the numbers that you shared with us a few moments ago, Dr. Samaan, one of our viewers is asking, of the number of children who were infected with COVID in Canada, what percentage had type 1 diabetes?
That's a good question. We actually are not sure. These numbers are reported in aggregates, so there isn't any breakdown for that data.
Fair enough. So let's think about another angle on this, because I know that those of us with type 1 with young kids are kind of watching media reports regularly and trying to make heads or tails of what we're reading. Some media reports lately have been talking about COVID-19 triggering diabetes in some people. What would you share with our viewers about the evidence about that?
So there has been some very early evidence that COVID-19 may be triggering acute diabetes in some people, but there's a need for a lot more information before we can actually understand this issue further. One of the things that we're unclear on is whether the virus in fact leads to a high blood glucose level because it is getting inside and disrupting the function of the islet cells, or is it actually damaging or destroying these islet cells? Or indeed, does it affect the different organs in the body that are important in regulating blood glucose level, like the liver? Certainly, it has been reported that the protein that the virus uses to enter into the respiratory cells is expressed on the islets. And there's some early experimental evidence that suggests actually the virus does enter islets, but these are experimental models. These are outside the body. They are not actually in humans. And so the research, again, proposes that COVID may have some effects on the islets, but we are watching this area of emerging research closely to better understand this and to even decide whether this is going to be a type 1 type diabetes, or is it type 2, or in fact a new type of diabetes. So this is definitely an emerging area of research that we're watching very closely.
Okay. So it's fair to say that families of kids with diabetes need to be a bit more vigilant than normal, perhaps, during COVID. Now, lots of families, even those without kids with complex medical conditions, are anxious about whether to send their kids back to school in September, given our concerns about COVID-19. What would be your advice?
My view is that we should try our very best to send the kids back to school. And there are many benefits to school beyond just education. I think both physical, social and emotional and mental well-being are really critical for our children. I think it's also really vital to be sensitive to the well-being of children, but also to the well-being of the school staff and teachers, who are very critical partners in supporting that return to school and the opening plans. How we do this then depends on the local situation with COVID-19 in a given community. And so community transmission patterns become really important. And all of these things are probably going to be very local moving forward. I think local public health agencies and schools are working closely together to ensure the safe opening of schools. And so reaching out to schools and being aware of what public health agency in the local setting is really important to consider. We have a section on our website, COVID-19childhooddiabetes.com, where we actually included a list of provincial and territorial governments' plans to return to school. And these are updated regularly by these agencies. So it's one place where families may look for information. But again, local public health agencies, of course, are really critical as a source of information. So the situation, I think, needs to be monitored carefully to ensure that safety is maintained, and decisions, of course, need to be flexible at this point. But I do believe that we should try very hard to get the kids back to school at this point.
Okay, great. Now, I want to bring Elizabeth and Conrad into the conversation very soon, but just before I do, I've got a couple of great questions from our viewers that I want to throw to Dr. Samaan, and then we'll broaden the conversation out. So thanks for your patience, Elizabeth and Conrad. The first question that I've got comes from someone who has a 2-year-old who was relatively recently diagnosed, and this viewer is themselves a teacher and is wondering, as they go back to work and are exposed to the kids and sort of by extension to the kids' bubbles or circles, what's the risk to that parent's child, and what would be your advice in terms of how to screen with young kids and all that?
Well, thank you. That's a very good question. I think at this point in time, and with the information that is available to us, we are really unclear on what's going to happen when we go back to school, but we anticipate that the risk for children is going to be small. So if it's going to be, the return is limited to that particular class with the particular person in question, that risk probably will remain small. Of course, applying the precautions that are important from a public health perspective, monitoring for symptoms and signs are all critical to ensure that the risk of infection remains as small as possible.
And we have a lot of concern for the teachers themselves. And we have a question from one teacher with type 1, another from a teacher with type 2 themselves, saying, what should they be doing to protect themselves and their families? What would you suggest, Dr. Samaan?
Yeah, that's a great question. And I think certainly it is very important to think about the collective safety of children, as well as teachers and other school personnel, when we ask that question about the safe return to school. I think the precautions, again, for a person who has a well-controlled diabetes, their risk is not higher than the person with no diabetes. the precautions they will take are similar to other individuals with no diabetes in terms of the hygiene practices, the masks, the isolation, all that additional pieces. So the risk to a person with diabetes, at least so far, in children does not appear to be higher. I think for adults, probably it's a little bit different. And I think that's a conversation that is probably quite relevant to have with the adult person's healthcare team to try and assess those risks a little bit further.
Look at it on a more individual basis, and if needed, perhaps seek some accommodations to reduce risk. Okay, great. So we've got more questions coming in, but I'm going to wait, and I want to welcome Elizabeth into the conversation. Elizabeth, as given your sort of professional expertise, but also as the parent of an 11-year-old with type 1, what's your perspective on this matter?
Well, as you've said, and as everyone has said, the decision is very individual. And there are a lot of different variables at play when you decide whether or not to send your kids back to school. As you mentioned, Kim, my daughter's 11. She has type 1. She's on her way into grade 7 into a new school. So when I listen to parents, what I find interesting is not so much the ultimate decision, but what their thought process was and what kinds of things they thought about as they made that decision. So I'll give you mine. Here's how we went about this decision. So first was our family situation. We do not live in a multi-generational household. We do not live with people or have people close to us who are immunocompromised. So that was one consideration for us. Secondly, my husband and I both work from home. We're fortunate that way. So we're not out in the community raising our family's risk of disease. And we're able to be flexible. We're able to use our cars to get our kids to school and not have them on the buses. So kind of to reduce some of those high contact situations. The age of my daughter is also a consideration, and the fact that she's had diabetes for a little while. So she's on her way into grade 7. She's on her way into a new school. She has some technology at her disposal. She's more self-managing than she was when she first started school at the age of 4. So those were also some considerations in our decisions. And then when I look at the school protocols, all of our schools here in Ottawa are taking various mitigation measures. And because my daughter's in grade 7, she will be masked when she's at school. So that too gives me an added layer of reassurance that her risk will be low. I did listen carefully to Dr. Samaan's colleagues who asked the question, if my daughter didn't have type 1, would I feel comfortable sending her back to school? And that's the way we've made most of our decisions about diabetes since she was diagnosed. Would I let her do this if she didn't have diabetes? And for us, given some of those considerations, the answer was yes, I would be comfortable sending her back to school. The other piece that factored into the decision was distance learning. And we've, like everyone, we've been home since March. Distance learning was not a successful or positive experience in our household. We have 2 parents working, 8+ hours a day from home. We're not able to dedicate as much one-on-one time as we could. And both of our kids themselves expressed challenges with motivation in terms of distance learning. So my daughter's perspective came into play as well. And then finally, but probably, one of the most important driving factors in my decision is a mental health perspective. So, a little bit about what Dr. Samaan said is that, there are many aspects to school, and socialization and that in-person aspect of learning is really important, particularly for, in my daughter's case, someone who's going into a new school, a new learning environment. I felt that it was really important and that it would really be in her best interest, all of those other factors into consideration, but that ultimately her mental health would be best served by sending her back to school.
Elizabeth, that all makes such great sense. And I think that was such a helpful framework for your decision for you to share with us. So thank you. Conrad, would love to hear from you. Your daughter just turned 6. Where are you guys at on this issue?
Well, thank you very much. So we have had numerous discussions in the house to try to figure out what is the best course for us. And I have to say, for us, with our daughter Chloe being 6, it was a relatively easy decision. We both, my wife and I, felt that there was no way that we would be sending our daughter back where the class sizes remain the same and masks are not mandatory. And the basic reality that kids in such a lower grade are going to have a hard time adhering to the safety protocols that have been put in place. I think even if masks were mandatory, being in such a young grade, I think one kid would go to school with a Spider-Man mask, trade it with another friend at lunch and come home with a Black Panther mask. So I mean, realistically, we feel there's better social, or I should say physical distancing happening at a department store than there would be at a school. If class sizes were reduced, I think we would have a little more comfort in sending her back. With Elizabeth, I'm almost in the same position where my wife and I both have the comfort of working from home. Our employers are good like that. And we have access to the technology. So that made it easier for the distance learning. And with what Dr. Samaan said, completely agree. Someone with type 1 diabetes is not at a greater risk of contracting COVID. But with COVID being so new, we truly don't know if they are or aren't at a higher risk of a worse outcome if they do contract it. I'm a data person by nature, so looking at the data we've been using, it's mainly being collected by hospitals from when children have been at home since March. We're not really looking at data coming from primary care, and I think we need to start incorporating what's happening at the primary care community level and looking at the outcomes in the hospital level. But we don't see that because number one, children weren't at school when the data is being collected. So we don't know the true effect of what happens if kids are put into that situation. Sick day management for us, we've had our fair share of managing ketones when Chloe was sick. And to take you back to last summer, we were managing it and she developed lower lung pneumonia. So with COVID affecting the respiratory system, it's a huge concern. On the flip side now, we have an 11-year-old who is going to be starting grade 6. And she's at that age where she's maturing, and we feel keeping her home, she can actually miss out on that fundamental rite of passage where she starts to define her friendships and reinforce her social circle. As for learning, I found being at home, it gave her that real world knowledge that she needed. Scan your documents, use your computers more often, start videotaping yourself and sending it in, doing things to that extent. So for us, it was a hard trade-off, right? It's managing our 11-year-old's mental health and being at that level, and also looking at the decisions being made, which are not really based on data-informed decisions just yet. So for us, we decided we're going to keep them both home and provide them the supports that they need.
All also excellent points, and really reinforces the message that it's an individual, family by family kind of decision that we all have to take. So thank you for sharing that, Conrad. We've got lots of questions. So the first one that I'd like to pose to you, Dr. Samaan, should we be looking at this differently where it concerns kids in grade school versus of high school age?
That's a good question. And certainly it appears from the data that we have so far that younger kids seem to be at lower risk than older kids. But again, I think we need a lot more information before we can actually break it down and say that, one group is more protected than others. So I think more data definitely is needed to answer this question.
Fair enough. Someone here is wondering whether it's safer from the perspective of minimizing the risk of contracting COVID for people with diabetes to use a continuous glucose monitoring device rather than finger pokes to minimize sort of creating those breaks in our skin. What do you think about that?
So that's a good question. There has been debates about this, even among colleagues recently, and there's certainly some thought that this might be a good way of monitoring the blood glucose levels and making decisions based on them to minimize finger pokes. And that actually became really important, for example, in discussions about kids who are admitted to hospital, because you want to minimize the staff exposure to multiple finger pokes during the day, and to use CGM. CGM has not really been approved yet for that purpose, but I think these are all very interesting thoughts to kind of explore.
Well, and just as for the information of our viewers, Diabetes Canada is going to be launching an advocacy campaign to encourage all provinces and territories to increase public coverage of flash and CGM devices as part of the sort of roster of diabetes devices that we need to have at our fingertips. Forgive the pun. So please do stay in touch with our social media channels and participate in our letter writing campaign, where you can really easily write to your member of provincial or territorial parliament in support of that. That should be launching within about a month from now, so mid-September. Next question is, if this one viewer's child has been, lives with type 1 and has been hospitalized for an enterovirus before, does that increase the risk that that child might develop severe COVID? Is there a relationship?
That's a good question. I don't believe there is a relationship between prior exposure to viruses, including enterovirus, and a more severe COVID infection. So I don't believe that would be a concern at this point.
Okay. I mentioned at the outset of our webinar that we won't get into specific comments on the specific back-to-school plans of individual provinces. But one of these questions brings up a theme that I've heard in many jurisdictions, which is that of class sizes. And so would your opinion, Dr. Samaan, be that larger class sizes are putting kids at greater risk?
I think that the information is really not available to us to answer this question comprehensively. I think the evidence base remains limited. I think the idea that having a smaller class size with the physical spacing that has been advocated to reduce the spread of the virus is important. But again, it is very unclear whether, using the other measures of protection, including masks and hygiene, would actually be important mitigating factors that might actually reduce the risk of the spread. So I don't know if we know the answer to that question at this particular point, but it's something certainly that is actively going to be looked at once we get the kids back to school. Okay.
Now, one of our viewers is wondering whether teens living with type 1 diabetes might have a slightly greater risk profile vis-a-vis COVID-19 than, say, younger children. Is the risk factor or profile of a teenager a bit more close to that of an adult, or what's your sense of that?
So one of the, I suppose, indirect lines of evidence about this comes from looking at, for example, the expression of the protein that the virus uses to enter the airway. And that protein is actually expressed at lower levels in younger children who are below 10, and the expression goes higher in those between 10 to 17, but not as high as the adults. So it is, again, unclear whether that poses more risk, whether the virus needs more of these receptors to enter the body. So I think we just don't know. It's a great question. I just don't think there's enough evidence yet to stratify this risk by age so far. Certainly, one of the things that were noted in the US that some of their admissions were actually related to younger children, in fact. So infants seem to be admitted more frequently to hospital than older kids. So all these, again, are limited sources of information that we're trying to kind of put together to come up with a conclusive statement about this. I don't think it's very clear to me at this point whether actually younger kids are at less risk or at higher risk of the virus, and for teenagers it's the other way around, of course.
It's an unprecedented time in so many ways, but I've seen a lot of folks commenting about how challenging it is to make as important a decision as this with as many unknowns as we still face. And I think that that's just irrefutable. Dr. Samaan, many families have both a child and perhaps an adult in the home who live with type 1, maybe even other children who may not have it. Would your risk tolerance for going back to school change if you had an adult with type 1 as also in the home?
So that's a good question. Again, I think for me, I'm not as specialized in adult conditions, but if we have a child with type 1 diabetes at home and there are adults at the home, the risk for that child getting the infection remains probably very similar to kids who don't have diabetes. So I'm thinking about it the other way around, the risk to the child. The risk then, if a child goes to school and gets the virus, I think that really, first of all, depends on the risk for the child getting the virus, and then the possibility of that coming home and infecting an adult. I'm unsure really of the answer to this question. You know, are we going to increase the risk for adults at home by sending kids to school who may or may not bring the virus? I think the one thing that we see, again, children are at lower risk than adults of getting the virus. And so the key for us really is to keep community transmission at a lowest rate possible, because that means probably schools will have lower rates of COVID, and that in turn will reduce the chances of the virus actually coming to the home and infecting other people.
Okay, great. So we know that whether kids stay home or go to school, there are probably a few tips and tools that parents can be considering under both scenarios. So let's start maybe by speaking to parents that are going to be choosing to homeschool their kids with type 1. Dr. Samaan, are there any particular considerations for those kids that are related to the fact that they live with type 1 diabetes?
Yes, I think, I mean, one of the issues, of course, is recognizing, you know, that we live certainly through an unusual time, and you know, blood sugar levels and patterns will likely behave unpredictably at some point. Certainly maintaining diabetes routines and watching out for changes in insulin needs and activity and stress levels, that's really important. Maintaining a healthy lifestyle, you know, the nutrition side of things, activity, sleep, and stress management is really important. Maintaining social connectivity for kids with their friends and their teachers and community, that's really quite important, and using virtual platforms to do so. I think it's really important to check with the young person themselves about you know, where are they at with COVID? You know, having these conversations to understand what questions they may have, checking regularly that no questions have come up, and letting them know that they can ask questions, allow that to take place. Checking on stress levels and accessing family doctors or local mental health support is really important. And I think reaching out to the diabetes team with any questions that families may have is really very important at this stage.
Great advice. Conrad, you shared with us earlier your family's choice. Does that advice ring true for you, and how do you think that might help you in parenting your child or children?
Yep, no, those are very great suggestions. I think when it comes to diabetes, we all know that one size doesn't fit all. So it's going to be looking at individual needs and looking for changes and just taking it one day at a time. I mean, being at home, there may be less physical activity, so insulin needs can increase. I think the main thing that I'm trying to get to my kids is that being at home is not going to be an extension of their summer vacation, right? Like, they're going to have to stick with a schedule. They need to get up at a certain time. They're going to have that routine. And I think keeping that routine is going to be key to making this remote distance learning actually work. And yes, you know, we live in a great country where we have access to amazing healthcare. So please stay connected with your diabetes care team. I think that's key.
Well, if you come up with any good tips on how to get your kids to do chores, for example, please do send them my way. I think we're all, as parents, pulling our hair out at this time of year dealing with that issue. Dr. Samaan, what would be your advice in terms of those with type 1 whose families are choosing to have them return to school? What should families be watching for?
Yes, I think certainly, a safe return to school really extended from, how we transport kids to school safely. And once kids are there, how do we ensure that the spaces within which they are living for those few hours in school are safe? So certainly ensuring that the diabetes individual care plans have been developed before school starts is important, and that making sure that the staff from the school are provided with education and the information that are necessary. Within those spaces in the school, certainly having adequate ventilation, making sure that the precautions for masks for some children, if it's possible to use them, and including hand hygiene, surface cleaning measures, social distancing within the school, and then school cohorting of kids in a smaller groups with their educators, making sure that we avoid large congregations of kids in a school is really important. Reducing the number of people who come to the school or visit the school is another important piece. For kids who go to school, it's important to add a supply of wipes and hand sanitizers and face coverings in the school kit so that it can be used. Try and minimize sharing personal items like lunch boxes and other pens, etc. And I think it's important that we screen the kids on a daily basis for symptoms, and not to send them to school if they have that, and making sure that we have enough supplies for diabetes management at home to ensure that they can be used to manage diabetes.
You mentioned screen kids daily for symptoms. Are the symptoms for kids the same as they are for adults, or what should we be watching for?
So that's a great question. Again, we have added a list of symptoms on our website to allow parents to look at how different it is. Some symptoms certainly are different in children than adults. We see a little bit more gastrointestinal symptoms like nausea and vomiting seems to be a little bit more common in children. But things like shortness of the breath, fever, looking unwell in general, these are again things that parents should look at. And there are lists of symptoms that parents can look at, again, from the Public Health Agency of Canada that are available to use to screen kids on a daily basis before going to school.
Fantastic. And there are resources, I know, Dr. Samaan, you mentioned the website, COVID-19 for children with diabetes. We will be sharing that URL with the recording of this webinar. There's also some resources on diabetes.ca/coronavirus. So Elizabeth, I want to get your reaction to the advice that Dr. Samaan just shared for those going back to school. And I'd also love to know, given your leadership at Diabetes at School, what are some resources that families who are sending their kids back can avail themselves of?
Thanks for that. We have lots of resources that parents can use. I think that, one of the most important things to remember if you're choosing to send your child with diabetes back to school is that your child still has rights to be safe, supported, and included even during a global pandemic. So a global pandemic is no excuse for anyone to diminish those rights or to say we can't provide those rights. Might it be different and challenging? Absolutely. So I think it's really important for parents to, first of all, believe that, and second of all, to think about that in your approach to schools, to your principals, to your teachers. Know that, they are dealing with a lot right now. There's a lot of confusion and a lot of, changes on a day-to-day basis. So take that into consideration when you're doing your planning, your communications, when you're, asking for their time. Just remember the situation that they're in, and that having that good supportive, collaborative relationship is really kind of at the centerpiece to keeping your kid, your child safe at school and making sure that your child has the supports that they need. As Dr. Samaan said, the individual care plan is, the most important thing that you can start working on right now. Do check to see if your board has a template. If they have a template, by all means use it. If they don't, you can check Diabetes at School for templates there. We have resources for helping to train staff, and many of those resources, because you probably won't be able to go into the school and do that face-to-face training as you might have done in previous years. Some of those resources you can recommend to staff how they can self-learn, so you can maybe give them a little path on which videos to watch or which documents to read. So it's training that can very easily be done virtually. Give some thought as to, given the current situation, what might be different? Some things might be a little easier. We probably won't have to deal with field trips this year, something that is often challenging for parents. But some things are going to be a little more challenging. So just, give that some thought and adjust your plans. But the main message is that things will be different this year if your child goes back to school, but it's still possible, and you should still receive the support that you would have otherwise received, even if it's in a bit of a different way.
Great suggestions. Thank you. And I would certainly encourage all of our viewers to visit diabetesatSchool.com.ca. We can include that URL as well in the comments to this video when we post it. I'm going to take a few more questions from our viewers. So the first question is, does hand sanitizer, the alcohol in it, affect blood sugar readings? Obviously finger pokes. Dr. Samaan.
It's a good question. I'm not sure actually of the answer to this question, but we can certainly look it up and get back to you on that. Very interesting question.
Yeah, it's a great one. I hadn't thought about it much myself, but I suppose that at a minimum, it would probably be a good idea also so that it doesn't sting too much if one sanitized their hands and then let it kind of dry for a minute so that the alcohol's maybe a little bit less active before doing a finger poke.
So just, if I could just add my 2 cents to that. So when my Chloe was diagnosed, we were told if we're out in public to use the alcohol swab, but never use the first blood drop, always use the second blood drop. So in case there's any contamination with the alcohol, it's gone with the first one. And so there's just a little tip.
That's a good tip. You'd think I'd have heard that one in 25 years. Someone else is wondering, and this is an interesting question to me. This person has a child with type 1, and that child's grandparent had COVID and was on a ventilator and very nearly died. Would that grandparent continue to carry any of that virus? And is that child perhaps at greater risk because of that? What's our sense of, again, recognizing all the research is emerging, what's your sense of that, Dr. Samaan?
So the evidence, as far as we understand it so far, is that when a person gets infected with the virus, they do develop an immune response to that virus. And we are unsure really whether that virus actually now lives on an ongoing basis in the airway and whether this person will continue to shed this over a long period of time. I think these studies continue to emerge at the moment. So that is actually a difficult question to answer at this point. But the other thing that we actually are not very clear on is what is the infectious dose necessary to cause an infection? So, how many virus particles do you actually need to have an infection? And so that threshold really has not been very well defined. The risk to children with diabetes, I suspect, will be similar to children without diabetes, if diabetes is well controlled. But these are all great questions, and I don't think we really know yet.
Mm-hmm. Fair enough. I've had some great comments coming in on the hand sanitizer debate, and one viewer offers that the fruity ones do seem to affect blood sugar. Another person saying that out east where they live, the guidance is not to use hand sanitizer, to cleanse your hands just before a blood glucose test. preferably wash with soap and water by preference. So I think probably a good sort of interim or happy medium solution might be to do that where possible, and if not, use Conrad's second drop approach. Dr. Samaan, many people with type 1 are at greater risk of having celiac disease. And so if I have a child with type 1 who also has celiac, is their risk to COVID any greater than someone with just type 1?
Yeah, thank you for this question. I don't believe at the moment there is evidence that having these two autoimmune conditions actually does increase the risk of COVID. So I don't believe the risk at this point would be more if diabetes is under good control.
Fair enough. Now, what about antibody testing? I think that many of us have been looking forward to the time that we would be able to test for antibodies for COVID. What do you think about our progress towards that? And what do you think about antibody testing as a means of kind of giving us comfort or reassurance in the near future?
So that's a good question. I think the question, I suppose, does COVID-19 generate an immune response in everybody? And what does the level of those antibodies that we look for to say they are protective against reinfection? In general, from other coronaviruses, typically they do not generate long-lasting immunity. And even should a person have a serum response and generate antibodies, that typically wears off over time. So it's hard to know whether COVID is going to be different. There are studies that are ongoing at the moment to answer this very specific question. What does exposure lead to in terms of the antibody response? How long does it last? And does it actually protect people over the time that it is there? So we don't have an established titer at the moment of the antibody to say that's actually will be protective. Some people seem to respond more than others to the infection and generate a more robust response. And I think that's going to be important not only actually for the testing, but for the vaccines that are being proposed moving forward. What kind of protections are we expecting based on these interventions that hopefully will help us control this virus further?
So much still to learn. We've mentioned a few times during this webinar the mental health aspects of living with COVID. We know that there are many mental health challenges that can be associated with living with diabetes. Conrad, a question for you. I've heard some folks say, as we were doing some of our preparatory research for this webinar, that that experiencing the stress of planning to homeschool a child is perhaps reminiscent for some of the stress that they experienced as a parent when their child was initially diagnosed with type 1 and maybe a parent had to leave work to care for their child. Does that resonate with you? And how is your family and others who you're connected with, how are they coping?
Well, for us, again, we are fortunate enough that we've had the opportunity to work from home. And I know that not everybody has this, and it's definitely going to be a huge struggle for many. But we've been working from home since mid-March, so we got ourselves into this routine. So personally, for our case, it's not stress we feel, it's more of a reassurance and comfort knowing that the kids will get the education they need while being protective from the uncertainties with COVID. And that's exactly it, it's the uncertainties, because COVID is new. We've been dealing with it for just under a year. There's not enough, as we said numerous times in this webinar, there's not enough data or research showing outcomes in children with diabetes. Earlier this year, I think it was January, February, in a Toronto Star article, Andre Picard, who's a health reporter, drew a comparison to diabetic patients being told to know their numbers. If you have diabetes, you should know your numbers when it comes to managing your blood sugar levels. And how the same advice should apply to clinicians or institutions or the health system, that they should know their numbers as well. shortly after that article, we were thrown into this COVID-19 pandemic. And I just feel for us, you know, there's all these decisions being made with fragmented data, and there's no real access to reliable data from an epidemiological health population perspective to make these decisions. So a lot of people in my close circle and those dealing with diabetes, I have a diabetes blog that people follow, they feel the same way, that a lot of decisions are being made from the general health population perspective, but not really for those with a chronic disease, so chronic disease management, and then drilling that down even deeper into diabetes. So is it stressful? Yes, it's very stressful. I'm 100% with you on that. But then it's a personal decision. And I think with our school board, at least, you know, they're offering distance learning supports. You know, those who don't have access to technology can get that. So they're making ways for it. So again, for me, it's more reassurance rather than stressing of way back when she was first diagnosed. We always took the perspective that diabetes is not going to be this big, oh my God, my life is over, this doom situation. It's going to be something where we're going to thrive and be resilient from, and that's exactly what we're doing. It's trying not to go back there. It's just forging ahead forward.
Such a good point. And some of our viewers are asking for a link to your blog. So can we share that?
Sure. So there's one on Instagram called myt1d.ca. And it's the exact same website, myt1d.ca. So both of them.
Great, thank you. Dr. Samaan, this is a question I think for you. It was mentioned before that COVID can possibly trigger diabetes in some folks, or there's some research that's suggesting that may be what's happening. So this family has a pair of twins, one who has type 1 and one who does not, and a husband who also has type 1. So is her son who does not have type 1 at greater risk to COVID because of that possible triggering of type 1 by COVID?
So I don't think so, because again, the evidence at the moment really does not come from pediatric data. The evidence for this, for the association between COVID and this acute onset diabetes is actually from adult literature. There are no children so far that has been confirmed to get the virus and develop acute high blood sugar level. And in this case, there is no evidence that if you have a family history of diabetes, you're actually at more risk of getting COVID. And if you get that, you're at more risk of diabetes. So at this point in time, I don't believe there's any evidence to suggest that.
Okay. One of our viewers is wondering about the coverage on the challenges that folks in the US have been facing where it pertains to affording and accessing insulin. It's a heartbreaking situation that I know many of us watch with anxiety and compassion. So our viewer is wondering what specific steps are being taken in Canada to ensure access to insulin for Canadians. And if I may, Dr. Samaan, I might take a first stab at this, as this is something that Diabetes Canada is very closely involved in, and then I'll invite you to perhaps add anything I might miss. But to your question, Patricia, Diabetes Canada watches and has relationships with both Health Canada and the pharmaceutical associations, the manufacturers, to keep an eye on whether there are any localized supply disruptions or shortages of any diabetes related medication. We're not seeing any kinds of problems with respect to access to insulin, except for very, very localized, very temporary disruptions, like your pharmacy's out that day, but one that's 10 minutes drive away can get it. There are moves being made in the States to legislate an approach to bulk reimportation of insulin and other medications from Canada. The idea that some of these legislators have is that they could buy less expensive insulin for US citizens. And it's a complicated and complex issue, but the Coles Notes version of where we seem to be right now is that there are many hurdles to that kind of an approach working that include regulatory issues, importation laws, as well as the fact that the manufacturers themselves are not likely to wish to participate in that kind of a scheme. So we are staying very, very closely in contact with the regulatory authorities, as well as monitoring the supply on an ongoing basis and working to make sure that that never becomes an issue that would disrupt the supply of insulin for Canadians with diabetes. Saying that we have huge, huge empathy for the barriers that some are facing south of the border. Dr. Samaan, anything you want to add to that before we move to the next question?
I would echo that, Kim. I certainly empathize with the difficulties that we all have watched, unfold over the past few months down south. I don't believe so far we have seen any evidence of any disruption of our supply chains and the availability of all diabetes supplies. And there's no indication at this point that this is an issue for us here, for sure.
Great. Now, when kids do return to school, will you, or the clinics that you work in, prefer to see kids in person or continue to see them virtually? Will whether they go to school in person or not have a bearing, do you think, or is it too soon to know?
We haven't really made plans so far in terms of making that distinction. Our plan is to gradually resume in-person visits for families and kids that we feel are important to be seen in person. Our emphasis, at least on a short-term basis, is going to be on maintaining virtual visits in a significant way. And I think we will monitor the situation like all families, monitoring it and assessing again the safety of children, coming into the hospital when they are back in a school. So I think these are active conversations at the moment, and we're monitoring the situation very carefully. But we have not made any, permanent or immediate decisions about making that distinction for those kids who return to being in a school.
Fair enough. Now, last question, and then I see we're almost out of time. Some parents have written to Diabetes Canada wondering about financial supports that may be available for families with kids with type 1 who don't feel able to send their child back to school, but maybe favor a smaller private school program through the pandemic for whatever reason. So they're wondering what kinds of financial supports are available for that. The short answer is there's sort of no federal or nationwide program, but you can consider asking the individual school that you're looking at whether they have a scholarship program that you could access. Ceridian Cares offers some grant programs for compassionate care that may be possible for you to access at ceridiancares.ca, and we'll put that link in the comments. Local community foundations or service organizations like Lions Clubs or Rotary programs may be willing to support your family in that way, so you could reach out to them at the local level. Some corporations have bursaries or scholarships, so you could perhaps ask your employer or local businesses. And you can also consider a GoFundMe page if that's something that you think is the right choice for your family. So now I see that we're really at the end of our time together. I want to start by just thanking from the bottom of my heart our experts, Dr. Samaan, Elizabeth, and Conrad, for all of your valuable insights today. They've really opened my eyes, and I'm sure those of our viewers. As I mentioned, we will be placing a recording of this webinar on Diabetes Canada's YouTube channel, probably by the end of this week. So do please feel free to visit there and share it with your network if you feel it would help anybody else that you know. And I want to wish everyone a happy back to school, regardless of where back to school is taking place for you and yours this year. Thank you all, and be safe.